In this session, I will explain hypertension in detail. These days, there are so many people with hypertension, not just you, but probably many people around you as well. And the older you get, the more likely you are to have hypertension. So please listen carefully to what I have to say about this. There is essential hypertension, and there is secondary hypertension. So about 95% of cases fall into this category. Only about 5% of hypertension cases are secondary. Among people with hypertension, 95%. But what does essential mean? It means we don't know the cause. Isn't it something you're just born with? We don't know the cause? That's what it means. That's 95%. But why does this happen? Why does blood pressure go up without any apparent cause? I've always said this. As you get older, your blood pressure naturally goes up. So I said it's your age plus 90. That's hypertension. So look here. If you're 60, add 90, and that makes 150. So even if you're just 60, unless you originally had low blood pressure, everyone ends up with hypertension. Do you understand what I mean? Since it's your age plus 90, then for those who originally had low blood pressure, those who used to have low blood pressure are now considered to have normal blood pressure. So even those who used to have low blood pressure and now have normal blood pressure are all considered hypertensive. If you look at it that way, almost everyone ends up being classified as hypertensive. This is called essential hypertension. I've already explained the reason. As you get older, your heart function declines. As things like coenzyme Q10 become deficient, cellular vitality decreases, and as a result, function declines. Then it becomes harder to send blood to the brain. It's difficult to push it back up, right? So when blood vessels get blocked, or the kidneys raise blood pressure on purpose to send blood to the brain, for our bodies, the brain is the standard when it comes to blood circulation. Why is that? Try cutting off blood flow to other parts of the body. They just go numb, that's all. But in the head, brain cells die. That's why blood absolutely has to be sent to the brain. And the brain also uses the most blood. So as you get older, you actually need to develop essential hypertension in order to send enough blood to the brain. That's why when elderly people take blood pressure medication, they can experience things like orthostatic hypertension. Because the medication lowers their blood pressure, right? Now, when it comes to secondary hypertension, another name for it is renal hypertension. Another name for secondary hypertension is renal hypertension. So what does that mean? It means that the kidneys are the cause. Now, let me explain this a bit. Let's say you're under a lot of stress. You're really stressed out. As I mentioned before, your brain recognizes it. Oh, this is killing me. So what happens then? The hypothalamus activates the autonomic nervous system. It stimulates the nerves and enhances the sympathetic nervous system. That's why people who run businesses and similar individuals end up developing issues like panic disorder, Hwabiong, anger syndrome, arrhythmia, or even cerebral infarction because of this problem. Because of this issue, when people get stressed, they suddenly become agitated, tense, and fearful, and that's how these problems arise. Another part involved is the pituitary gland. The pituitary gland, this is what raises blood pressure, right? The sympathetic nervous system contracts and causes blood pressure to rise sharply, and then comes the pituitary gland. There are the anterior and posterior lobes, and in the posterior lobe, what comes out of the posterior lobe, as far as I know, is this. The antidiuretic hormone is secreted. At night when you sleep, during the day, you might urinate every 2 or 3 hours, but at night, you need to sleep soundly for about 8 hours, right? So the brain releases an antidiuretic hormone that prevents you from urinating so you don't have to go to the bathroom at night. But this, by suppressing it, diuretics are used. Diuretics make you urinate. So when I say that taking high doses causes you to wake up at night to urinate, it's not really a side effect. It's actually done on purpose. It makes you excrete water, so that's why it's called a diuretic. So when it comes to medicine, when you think of diuretics, you might think of corn silk tea. But you shouldn't just think of it as something that helps you urinate easily. It's actually suppressing something to induce diuresis. Next, in the hypothalamus, it releases adrenocorticotropic hormone, and there's a place called the adrenal gland in the kidneys. The system plays a crucial role in regulating various hormones throughout the body. Here, it is responsible for secreting essential stress hormones like adrenaline. And then, in the heart, the beta receptors are specifically activated. This process significantly increases overall heart activity and subsequently raises blood pressure. In the peripheral blood vessels, the alpha receptors cause the blood vessels to constrict, which also contributes to raising blood pressure levels. Furthermore, in the heart and kidneys, there is a hormone called aldosterone, which actively promotes the process of sodium reabsorption to maintain balance. When you urinate, aldosterone causes sodium to be reabsorbed, making the blood thicker and saltier. This leads to water being absorbed as well. So just like when you eat salty foods, like when you eat ramen and it's salty, your blood pressure goes up. That's what this is about. When your blood becomes saltier, it draws in more water. So the volume inside your blood vessels increases. By absorbing more water like this, it also plays a role in raising blood pressure. In various ways, it works to increase blood pressure. Why is that? It's to quickly raise blood pressure and circulate blood faster so that people can win in battle. That was the first reason. And the second reason is when a blood vessel gets blocked somewhere, like this. Then the blood is supposed to flow, but it can't. So, like this. Then you proceed exactly in this manner. You must understand that it is an essential requirement to increase the total blood volume to send it through the system, right? So right here, you really need to focus on increasing the blood volume. That is precisely what occurs. By doing this, you are successfully increasing the blood volume. And for example, by increasing the blood volume like this, you ensure that you make the blood flow smoothly and effectively. Just like this, you achieve the flow. Here too, it's because of the antidiuretic hormone that blood pressure goes up. Blood pressure medication is a diuretic, Next third, the blood vessels are originally soft and flexible like this. But these initially flexible and soft blood vessels gradually become stiff and hardened due to the presence of homocysteine, or excessive accumulated calcium deposits. What do we call this? It's called arteriosclerosis, hardening of the arteries. When they become stiff like this, blood pressure rises. So why does this happen? Why does calcium build up? Because parathyroid hormone causes osteoclasts to dissolve bone. I've mentioned this several times in my lectures. If you listen to those lectures all the way through, you'll understand this right away. You'll realize, oh, this is all connected. That's how arteriosclerosis occurs together with osteoporosis. You'll come to understand it like this. Since I'm explaining this briefly in about 10 minutes, if you listen to my other lectures several times, you'll be able to understand the more detailed parts. This is how bone hypertension progresses. So what about medication? As for medication, as I mentioned earlier, you use diuretics. And since the autonomic nerves are excessively stimulated here, you relax them, suppress this side, and when it comes to this side, you suppress it as well, just like last time. The medication that caused problems because toxic substances were found in Chinese-made hypertension drugs was this one. There are medications that inhibit aldosterone and medications that block metabolism. By using these, you create this effect, and since it works like this, you suppress it. When you do this, you suppress it. When you do that, you suppress it. These are called beta blockers. They're called alpha blockers. And besides these, in the heart, calcium is pulled in and makes the contraction stronger. So there are drugs that prevent calcium absorption. These are called calcium channel blockers, which block calcium absorption. Shall I show you something interesting? They use these alpha blockers for hair loss. This is a medication. It's a drug that blocks something. Why do they use hair loss medication? If you listen to my lecture on male sexual function, this topic comes up. But this drug is recognized as a vasodilator. Since this one causes constriction, if you expand the blood vessels and draw more blood goes to the scalp. So they use it together with male hair loss medication. This drug opens up the blood vessels and causes a lot of blood to rush in. So what did I say the side effects of this are? Of course, there's a risk of high blood pressure. But during an erection, When you have an erection, a lot of blood needs to flow to the penis, right? So if you take this, a lot of blood does rush in. Erections work well. But on the other hand, when it comes to ejaculation, it's the opposite. You need to strongly activate the sympathetic nervous system to expel it. But that doesn't happen. So you don't feel the urge to ejaculate and you can't ejaculate. That's why this kind of dissatisfaction occurs. You can get an erection, but you can't ejaculate. It's called delayed ejaculation, and this is the kind of drug that causes it. So the details about the medications are explained thoroughly in the expert course. But here, I'm giving you an overview so you can understand the overall picture. So that's why those phenomena occur. I'm giving this lecture to help you understand those phenomena. That concludes the lecture.